Hello everyone, I'm Charlotte Kilpatrick reporting for Vaccine Nation from the World Vaccine Congress in Washington. I'm delighted that today we're joined by Dr. McClenathan from Allucent. Thank you for your time.
Thank you for having me.
Not at all. Would you kindly introduce yourself and your role within the organization?
Sure. I'm Bruce McClenathan, as you mentioned. I am an Executive Director of Medical Affairs for Allucent, mostly for our government and public health business unit, and provide medical and scientific oversight. By training, I'm a board-certified allergist and immunologist and internal medicine physician with about 25 years of experience in clinical care, public health, vaccinology, and clinical research. And prior to joining Allucent, about 18 months ago, I spent most of my career in the Department of Defense, both as an active duty military officer as well as a civil service medical corps officer, with the last 9 years of which I served as a vaccinologist for the Department of Defense.
Fascinating. So you've had a very varied and busy career, it sounds.
I have.
Great. So would you kindly tell us a few of the key services that you and your team provide, or give us an example of one of these that you've maybe done recently?
Sure. Well, Allucent is a full-service CRO, and we like to refer to ourselves as the A-team because we have a deep bench of experts in various business units, whether it's regulatory strategy and drug development consulting, clinical pharmacology, modeling and simulation, clinical trial operations. And the one nearest and dearest to my heart is our federal research solutions, which again, I'm the medical director for that business unit. And we provide, again, full service CRO capabilities, but our government business unit focuses on federally funded research. We have several years of experience and have worked with U.S. government organizations from contracting to conducting and executing clinical trials across the globe. We have a footprint in over 60 countries, more than 30 years of experience, but have worked with organizations such as the National Institutes of Health, the U.S. Department of Defense, the Centers for Disease Control and Prevention, and I think, as you said, a recent example would be we were just awarded by BARDA, the Biomedical Advanced Research and Development Authority, under their clinical network studies, a large phase 2B trial for the next generation COVID vaccine.
Fantastic. I think we're hearing a bit about the next generation COVID vaccines at the Congress and efforts to advance this, specifically in the US as well. So it's exciting to hear that you're involved with that. Could you tell us a bit about how your approach or your maybe attitude in the organization is different to other organizations, or would you say that you're meeting a need that's currently unmet in this space?
Sure. Well, at Allucent, we like to say that we're small enough to care about our partners' product, but yet we're big enough and diverse enough to meet their various needs. And so we pride ourselves on taking care of our partners, and we truly feel like we're a partner as just another CRO. We like to truly partner with and solve the tough challenges that many of the small to mid-sized biotech companies face. So.
Fantastic. So if we're thinking in the next few years or possibly longer than that, what is the sort of ambition or the next steps for the organization?
Well, I think Allucent has a very, very bright future. We have, as I mentioned before, really a deep bench, so to speak, of folks that have been in the business for many, many years. We have former FDA regulators and the like on our regulatory strategies and drug development. We have very experienced pharmacokineticists in our clinical pharmacology and modeling and simulation, years and years and years of experience in our clinical trial operations. And in our government, federally funded solutions, we have folks that have come from various parts of the U.S. government, whether it's DOD, like myself, or others, and we just have a lot of experience in conducting clinical trials. And so I think that provides a unique slant on how we set ourselves apart from other CROs.
Fantastic. It certainly sounds like you've got the team for any job that presents itself.
Absolutely.
So my final question is,
Sure.
what are you looking forward to at the Congress, or what do you hope to leave having achieved?
That's a great question. So this is always a highlight event for me. The greatest minds in the vaccine field are really gathered in one place for 3 or 4 days, and so it's a great time to network with colleagues and to learn from really the best minds in the field of vaccinology. So it's a great event, and I'm really looking forward to just learning and networking.
Fantastic. Thank you so much for
Oh,
that.
my pleasure.